Next slide, please. So this lack of clinical standardization, and again, I'm seeing it on the front lines. There's no standard for cannabis screening, whether you're, talking to patients during the social history check. Okay, if they use cannabis, that's that. Or you do, document it elsewhere within the medical record, such as our clinic, who we document medical cannabis use in the problem list. But there's no standard approach to cannabinoid reconciliation. Do you use cannabis? There's so many various cannabinoids, and there's so many routes, and there's various frequencies. So those are not being captured anywhere. You could be, a patient could be consuming a non-intoxicating product, but if they say, yes, I use cannabis, it's a non-intoxicating product, I use it once a day, whatever, it's not captured, and it's just cornered into this hole with the stigma of, oh, they're a cannabis consumer or they're a cannabis user. Our approaches to patient care are not patient-centered. So even of those that do certify for medical cannabis and practice in this field, a lot of times it's just this, yes, you qualify, here's a blank check to go get whatever you want from the dispensary. That's not a patient-centered approach. That's not a counseling patients on what to utilize to treat their presenting symptoms, really their presenting condition. And what if they're coming for symptom management, but ultimately that underlying condition has not been worked up? They're going to a card-focused practice, and they may actually need further workup, and maybe cannabis isn't the right medication for them, but there is no standard approach to that and how we treat these patients. There's no standard approach to follow-up cadence. Most clinics out there, depending on which state you're in, that determines, some states require you to see your provider twice a year. Some require once a year. In Massachusetts, we have an ability to certify patients that are qualify for more financial hardship and have financial difficulties for up to 2 years. Who's following up on those patients during that time to see if their medication is working effectively, or worse, if they're developing a cannabis use disorder or side effects from over consuming cannabis? There is no standard follow-up cadence. And again, the same thing, just to reiterate, the patient-centered approaches, cannabinoid reconciliations don't happen. And visits are not, follow-up visits are not based on medical necessity. If you're coming to any provider for anxiety, for example, it's not like, okay, great, here, go to the pharmacist and ask, and I'll see you next year. That is not a way we manage patients, and that is not how we should be doing this with this medicine either.